Hello, my name is James Bauckman, Executive Director from Peace Centers in Bellingham, Washington. So I have been creating videos to share my ideas, inventions, and new systems to replace failing systems or create businesses to create products or services that I think humanity needs right now. Giving these all away for free. If you appreciate what I'm doing here and what our nonprofit is doing here, please go to peacecenters.org where you can make a monthly donation to help us continue to help more people. If we reach 2,000 $10 a month donors, we will never ever have to charge any fees for any of the things that we're doing to help schools get child care subsidies for low-income families by getting them licensed, by allowing families to come and get support and child care from us when they need it, to be able to help teachers and educators who want to open in-home family child care programs to get them licensed where we can help them do that, help them with their paperwork, help them with their fees. Your little donations can help us do that. And so I'm giving away any idea, invention, system that I feel like would be helpful and making little videos about them. So the one for today is my Healthcare for All plan. It is not the same as Medicare for All. It's not the same as anything that I've heard of. And I'm totally open to people who are professionals in the medical industry or in hospital administration or in government who have critiques and feedback to improve this. I've made a GoogleDoc that I'm putting up, and it's going to be available for everyone to review and give feedback on and improve and adopt, hopefully, in their communities or in their cities, states, or countries. And the way the system works is this. Okay, so you're going to have to sort of not think about healthcare as you know it, because this is not anything like you know. All right? So the basic way that this works is that it is going to replace the for-profit, rationed medical insurance industries that stop people from getting the medications or help that they need through surgeries or procedures or therapies because of their expense. We have an existing system that stops people from getting the care that they need in order to make money. And the intention behind those systems was not to create healthy people, to end sicknesses and disease and help people, but what they were made for was to make money. And our healthcare systems cannot function correctly if that is the intent. If the intent is not to heal people and help them be healthy, then the system that we have is sick and is going to just take money and ration care, and people aren't going to get better. I don't think anybody will disagree with the current system being a failure and that we need something different. Now, Medicare for All is the current system that has been proposed that I support, but I think that there is even a better way to do it, but I haven't heard anybody talk about it yet, so I'm going to talk about it. So the way it works is this. I get sick. I go to my doctor. My doctor says, oh, this is what's wrong. You need to go see this professional, you need to have this medication, you have to do this. And then you go and do the things that the doctor said. It's paid for, that's over. What? How does that work? Well, let me tell you. So that's the way it should work. Somebody who is sick goes to their doctor tells them what they recommend, advises them to meet with other doctors to get more opinions, to collect more data, have more tests, go get the things done that are going to fix them. Okay? Our current system doesn't make that easy, and actually you have to fight with the insurers to get the things that you need. And that's not at all how the system should work. So the way that I see this being financed and working, so I'm going to take my city, Bellingham, Washington, as an example, just because it's in front of me. Now, there are providers throughout this city, okay, that serve people within the city. There are expenses related to operating all of those providers. And when I talk about providers, I'm not just talking about the hospitals. I'm talking about chiropractors and acupuncturists and pharmacies and anybody, a physical therapist, massage therapist, vision, dental, all of those services. They have a base set of expenses to operate. You know, to make sure your staffing are there, that you have the equipment, the medicine, the tools, the rent, everything that you need to have a functioning medical system. Every quarter, okay, the expenses are tallied up for all of those systems, and they're submitted to the thing. So if you're in a city, you're to the city. If you're a statewide hospital or countywide hospital, your expenses are sent to your county. And then there's a new system of taxation that doesn't currently exist, that needs to be created, that is basically totals up the quarterly costs of the healthcare delivery system, and then divides up equally amongst the people who are living there, those expenses, and there is going to be some sort of mathematics involved that base your current earnings towards the amount of tax that you pay. There's got to be some sort of levelization for people who make more and make less. I don't know the answer to that yet, and that is something that I hope will come out of these conversations, that people figure out how to do that. But basically every quarter the actual expenses are tallied up, and that is a tax that will replace our healthcare expenses that we're paying for our copays and premiums, etc. Okay, so that now creates a system where anytime anybody needs to go use these services, they're open, they're available, they're paid for. Okay, you get sick, you go to the doctor, you get the help that you need. Now, on top of the tax, there are fees that are related to your use of the systems. Your medications, your therapies, your surgeries, your everything. Now, there will need to be a system in place that will create a loan similar to the college loans, where you, based on your ability to pay, how much you can afford to pay based on your income, will have, say you have $100,000 worth of medical debt. You had a heart surgery, you had a baby over your term, you've had some medical issues, and so you've got this $100,000 worth of medical debt. Okay, it's in either a zero APR or a low APR loan that is divided out over sort of a reasonable amount of time of your life, where you pay X dollars per month, and as new bills come in, it gets added to your account and it gets divided out evenly, and it's something that you pay down over your life. It's your responsibility because it's your health. If you are an unfortunate person who has health concerns that make it so you can't earn because you are disabled and are unable to work or earn a living, there are ways to help support those folks, because there are some people who have severe health needs and who cannot work, and they need to be covered by system. And just like Medicare, that these people will still need to be cared for. So there are those people who are going to fall into that system, and that there's currently no other way to deal with that. If you can't earn money, you can't pay your medical bills. It's just simple. But for the rest of us who can earn and have jobs and are making money, we go to the doctor, we get the support, the services, the medications, the surgeries, the therapies, whatever we need. And as a result, we have debt, medical debt, that we can pay back in a reasonable way at a very low interest rate. I would love it to be no interest rate because it's medical debt, and that makes sense. But there's probably some administrative fees and things that are going to need to be recuperated because somebody's going to have to administer those loans, etc. So maybe zero is not the right amount, but some small percentage. So now we're incentivizing good health. What does that mean? It means that if you take good care of yourself, you exercise, you eat well, you don't smoke, you don't do risky sports and activities, you're going to have less medical expense. Therefore, your medical loans are going to be less, and you're going to be spending less. So you have the power to control your expenses, which I think is a big complaint from a lot of folks who state that they don't want to pay for the bad health and bad activities of other folks. And I don't want to pay for that either. But I'm willing to pay taxes that will cover having all of these hospitals open and available and running, so that if something happens to me or someone I love, they can go get help. I 100% support that. But I also feel like it's our responsibility to take better care of ourselves. So if you're going to smoke and drink and skydive and drive your motorcycle without your helmet and things that put you at greater risk of higher medical costs, you have to pay for it. It's your responsibility. Now, it is through a loan system, and so you can pay it off over time. And I believe that if you get in a situation where you can't afford your medical debt, you get sick, you die, you are disabled now, that there's some ways to forgive those things and to get them taken care of. And I think that's something that's always going to have to exist, because if you are sick and unable to work, there's no way you can pay back medical loans. It's just not a thing. So we need to address that. That's a real thing. There are people who cannot work. There are people who cannot pay their medical bills. We need to be able to take care of them. We can't just let them die. We can't just let them suffer. And we need them to be able to get taken care of. And I think that's what society is about, is we care for the ones who can't care for themselves. I think if you're an American, that you should be part of that. You should believe that I'm here to take care of all Americans and make sure that they are getting what they need. And some of you may disagree with that, and that's fine. But for me, what's important is making sure that everybody can get the care that they need so that they're healthy. And I think it's really important that we are incentivized to do the right thing. I think there's so many things in the world today that incentivize bad behavior. Cheating, lying, stealing are like incentivized, so people continue to do those things because they can earn great wealth and get money from doing the wrong things. And I want to see more things that incentivize doing the right thing. And so having a healthcare system that is fully functioning, world's best care, and it's not right now, but it could be if we invested in finding out what our cities, towns, states, country needs, and investing to make sure we have those things. And then we all sort of collectively chip in our taxes to make sure those things are available to us. And then we also take personal responsibility for our health by, paying back our medical debt, and not in such a way where you get cancer and then before the doctor sees you, they're like, you got to pay me 50 grand. That doesn't work. That's why people die. That's why people keep getting sick, is because our medical system won't see people who are broke. But instead, if there was a system where you could get a loan, a low to no interest rate, to make sure your health is taken care of, and then you pay it back over time. And then we should, on top of that, we should be investing in retraining of people, giving people skills so they can support themselves. And that's a whole nother video for a whole nother day. But for right now, healthcare needs to be available. It needs to be comprehensive. It can't ration services and medications and therapies so people are dying and not getting what they need. But that's what the current system does, because that's how it was designed. It was never intended to help heal people and keep them healthy. And so we need to rethink what we do. And I think almost every system in America and maybe the world is similar. We don't make systems with the intention of doing right and doing good. We make systems to make money. And we make products to make money. But we need to think about doing it different, making systems that their intent is to solve the problem that they're created for. Healthcare, we all need and deserve and is a right to have healthcare. So we need to create systems that actually treat the problem and make sure people are getting the healthcare they need so that they can be healthy and can contribute to society and do a job and support themselves. But that's not how the current system is working. So that is my Healthcare for All plan. Again, if you appreciate the things that we're doing in the world to try to help families get affordable childcare, to be able to get the services and help they need, food, shelter, if you care about ending homelessness and hunger and child abuse and you want to help support peace centers, you can go to peacecenters.org. I would love to see 2,000 people donate $10 a month so we can keep doing this stuff for free and keep helping folks, because that would be the most important thing to me. My birthday is next month, so if you want to help and make a small donation to Peace Centers on a monthly basis, you'll help us so that we can keep helping families and not have to charge them for it. Peace.